Welcome to Logical Ayurveda. Today we are going to discuss about hyperhidrosis or excessive sweating. It is called Atisveda in Ayurveda. Hyperhidrosis is a condition marked by excessive sweating, often beyond what the body needs for temperature regulation. In Ayurveda, we say this is primarily due to the Pitta dosha vritti and excessive sweating tendencies because of Pitta dosha vritti in the Rasadhatu. And there are multiple causes of hyperhidrosis. You may think that SAR is taking a topic in logical Ayurveda as trivial as hyperhidrosis, but you don't understand one thing. You know, like in allopathic medicine, the treatment of hyperhidrosis often involves expensive and invasive procedures like Botox injection to the armpit area or wherever more sweating is there. Iontophoresis, which means usage of mild electric shocks for treating this, or even surgery. They cut off the end nerves that go to the particular region to stop sweating. But in Ayurveda, the condition can be effectively managed in a simple, natural, and affordable way, often within a budget of just 200 rupees per week, using herbal medicine, Ayurvedic medicine, diet, and lifestyle modifications without absolutely zero side effects. So as long as when it comes to skin disease, I'll give you that. When it comes to skin disease, Ayurveda is unbeatable, and skin disease is going to be the forte 1,000 years, even 1,000 years from now. That I'm very sure of it because you learn skin disease properly, you learn the doshas behind the twak. Definitely, you're going to be way ahead in treating, and you're going to be famous in Ayurvedic medicine. There are a lot of diseases which can be successfully treated in Ayurvedic medicine, but nothing comes as close to treating skin diseases or the Rasagata Vyadis, I can say. So, hyperhidrosis. What are the causes of hyperhidrosis? Causes of hyperhidrosis, one hereditary causes. You can see that if the father is more sweaty and the children or daughter is also having more sweating. Obesity is another main cause of physiological cause of sweating. Why? Because in obesity, there are a lot of fat deposition that insulates the heat from getting out of the body. Hence, heat is stored inside the body. So there will be obviously more sweating. That can be only cured when the patient reduces weight. It does not matter how much medicine you give. The patient should reduce weight to get rid of their sweating. So stress and anxiety, mental tension is also another cause of sweating. When you go to that exam, which you don't know most answers about, automatically you start to sweat in your hands and feet, etc. Anxiety is another important cause of sweating. So excessive alcohol consumption, obviously, taking excessive alcohol increases pitta. Therefore, definitely Atisveda as a symptom will be there. One of the most important causes of Atisveda is thyrotoxicosis. It means the patient's T3 and T4 is much higher. I mean, so much higher that there is toxicosis that is going to be present inside the body, along with the symptoms of weight loss and protruded eyes, etc. Hair fall will be there. Whenever there is hyperthyroid, the sweating will present. You should be very careful. If you see all those Shaya lakshanas in the patient, definitely check for thyroid, just to keep the backlog of how things are working out, and after the treatment, how much it is reduced. So, and other neurological problems related to lesions of brain, spinal cord, nerves, etc. This hyperhidrosis will be there. So, what is the clinical features of hyperhidrosis? Profuse sweating, especially on the palms, hands, soles, feet, armpits, or axilla. The problem with hyperhidrosis, it's not as much as a problem physiologically or pathologically, but the problem comes with low self confidence, because you smell more, you sweat more, you smell bad, and you cannot go next to a person. It destroys your confidence. So the patients really will be worried about that, and will be finding solutions, and will be ready to go to any extent possible to treat that. So, I mean, it will interfere with the daily life, and really impair your social confidence. So, really, except thyroid, I don't think any test should be needed. So, treatment principles, there are two kinds of treatment principles. One, you can either do Shamana, which is the most easy form of the treatment, and you can do Shodhana, you can do a classical variation or Sadhya variation. But in my experience, there is not much needed of classical virechana for simple problems such as hyperhidrosis. You can go with Sadhya virechana. And internal medicines, when it comes to internal medicines, I can frankly tell you, most of the patients who cannot do Virechana or who cannot follow multiple things that we tell, I simply prescribe Mahatiktakam, Saribadhyasam, and Avipati Churnam. You even have the video of Mahatiktakam, Saribadhyasam that I have given before in Logical Ayurveda. You can also refer to that link. Because people may teach you thousand things, people may teach you textual things, people may teach you thousand things, people may teach you that or multiple options when it comes to treatment, but really what they will follow will be a lot different. So whereas in my case, I'm ready to tell you whatever it is needed to improve your practice and what works for me in the best case. Because if you give 2 tablets of Mahatikta Kashayam before food and 30 ml of Saribadi after food and Avipati 1 spoon in the night, or if constipation is not there, Avipati is not also needed. That is very simple for the patient. Patient can keep half Sariba in the office and patient can keep half Sariba in home. They can give one strip of tablet in the office and one strip in the bike and one strip in the wherever they are working, and it becomes a very easy part of the treatment. I prescribe Mahatiktam and Saribadhyasam, and in the next stage, I can go for Grita. Like I can next stage, I'll change that into Guluchadi Kashayam and Mahatikta Gridam, either as a Gritam or a capsule form or Kashayam tablet form. I can give, and I will change it to that. And in between, monthly once or 2 months once, I'll give Sadhya Virishna either with Drakshadi Kashaya and Avipati Churna or Tribal Lehya or whichever choice according to the patient. I'll be giving Virachana. See, one problem with prescribing all those things, Mahatikta Kashayam, is that body tends to get ruksha, not with the Grita, but with the Kashaya. Body tends to get a little ruksha. That is where if possible, the patient is in a condition to make Kashaya at home. I'll ask them to make Shatavari Shira Kashaya, like 1 spoon of Shatavari boiled in milk, and they can take that 100 ml in the morning and night before food, before having food. That will also be possible, but for many patients, that is not a sustainable thing to do. They don't have that much time to do it. I'll stick with Mahatiktam Saripati. It may take a little longer time, but definitely the results will be achieved. And Patya, definitely they have to, avoid the Pitta aggravating foods. They have to take Pitta pacifying foods like ghee, fruits, sweet fruits, like apple, anar, etc. And Pitta pacifying foods like diluted milk, etc. And definitely they should not be going for Pitta Vardaka Aharas, like chicken, fish, lot of sour foods, lot of spicy foods, and horse gram, sesame, and curd, meat, etc. Definitely they have to avoid. And I will ask the patient if you can choose weather. Definitely you can choose cold weather. For example, if the patient works in IT, they have 2 choices to where to live. They want to live in Chennai or Bangalore. Definitely, I'll tell them you can move to Bangalore than Chennai because hyperhidrosis will definitely be more in Chennai. So, location and weather adjustment can be done if that is an option. So, I thought I will discuss the hyperhidrosis in the skin seminar, but definitely I thought I'll give this before itself. There is also a skin webinars that is going to come up in Logical Ayurveda. We'll let you know very shortly, and we are working on that. The aim is to provide doctors with a detailed knowledge of skin diseases and its treatment, and to make them comfortable in OPD. So as and when it comes, definitely we'll be happy to let you know.